I think when the government decides upon something, I, being a government servant, I cannot say that the decision is right or wrong, but maybe at the governmental level, whatever decisions that is being given, I believe it is in the interest of the public only. It should not be taken as a threat. Because as you have been seeing from people or through media or in whatever form it is, false information may be imparted to one another, or even to the extent that even in the medical frontline workers, so to say, people are not cooperative enough. And to safeguard the given population, for that very reason only, this order was issued. Now, as you can see, that there was a court order which says that it is up to the individuals to decide whether one likes it or not. It's up to the individual. But at the same time, we have received a suo motu order from the court asking the department, why are you not vaccinating your frontline health workers? So, on the one hand, the government is coming up with such an order, but at the same time, from the court also such an order came out. So, for that very reason, in the department, we have given the advice to the medical fraternity, the frontline workers, to get themselves vaccinated, or if you fail to get your vaccination done, then you should get your test every 15 days before you report for duty, so that you don't spread the disease to others, or you yourself don't get the disease from others. So, for that very reason, we have issued a circular to all our medical workers, professional workers in the districts, in the entire state. See, after repeated advisories being given, there are so many who are still yet not vaccinated. And these are the people who will keep on spreading the disease. So, for that very reason, we have been issuing all these instructions to our health workers. As I've said, maybe at the governmental level, they have issued that order that you get vaccinated, or you don't come to the office, or your salaries may be withheld, or you may be asked to go on leave. That was some options which were there in the pipeline. But personally, I feel it is in the interest of the public only that the government have to come out with such an order. Otherwise, if we look into the given population, there are so many knowingly not coming forward for the vaccination. So ultimately, this is the only way out whereby to safeguard the public interest. And in such a pandemic situation, when we don't come out strong on the population, I don't know how far the government will take action, whether to withhold their salary or not, but strong advisories has to come out, or in a form of an order it has to come out, so that people are being compelled to come and get their vaccination. That was one way out through which maybe this order was given.
Sir.
So that the court order should be there to give us the reply in 3 days' time. If you don't vaccinate your healthcare workers, then give us the explanation. That was the court itself giving us such an order. No? So we are left with no option but to give advisory to all the health workers that either you get yourself vaccinated or you will have to test yourself every 15 days when you come for duty, or if you cannot comply, you may, basing on the government order, we have issued the order stating that you may have to go on leave or to the extent of leave without pay. That was basing on the government order that we have done. Now, I cannot override the decision of the government. It is under the government we are all functioning. So if there is any resentment or outcry against such orders, it will be not at my level to give that answer. See, as far as the department is concerned, we are giving free testing kits to all the districts. Maybe in a commercialized area like Khimiao or Dimapur, where influx and outgoing, these are rampant. So in certain situations, they may be doing that. But otherwise, we are giving these test kits free for all. If we are able to contain the second wave in a more successful manner with the amount of vaccination that is going side by side, if it is successful with vaccination program, like the way we are giving intensified vaccination programs to all the districts, if the given population coverage is fair enough, then we may not have to face the reality of having the third wave.